Victory Motion, home of knee repair, not knee replacement, right? A part of that knee repair, not knee replacement program is genetic-based nutrition. Now, there has been several studies, one famous one out of Stanford, that showed that when you test people's genetics and give them a nutrition plan based on their genetics versus just a vague plan, the people who get the genetic-based nutrition plan lose exponentially more weight compared to the people who are just getting a generic plan, right? So a piece of what the genetic test looks for is what foods are likely to be pro-inflammatory in your body. So some of those foods include, gluten, lactose, some oils, right? There's a ton of
Yeah,
oil
seed oils, right?
cause inflammation in the body. I always like to tell people about my experience with gluten. I found out that that is something that inflames me. As soon as I got that out of my diet, I had less muscle soreness after exercising. I had, less gastrointestinal issues, all sorts of stuff like that. But it just goes to show that your genetics play a role, like where you're from, where your lineage is from, play a role in what foods may cause inflammation and what foods may lessen inflammation. So to kind of sort through all of that without just guessing and checking, getting a genetic test is super important to nail down exactly which foods will react well with your body and your genes, right? So that's an overview of the program that we have here. Obviously, there's supplementation is part of that, and behavioral changes. But that's a big piece of it is understanding exactly what's going on in your body, what your body wants, how your body is going to lose weight based on what you take in, right? So that's
Yeah, that's a simple, just a mouth swab that
yeah.
gets sent off to the lab. And then I did it myself, as you know. And you get like a 32-page report. If you want to geek out, you can read it. But the cool thing is that we have people like you, and we have some diet nutrition experts who will be your coach for 3 months to interpret that. And you don't have to interpret it if you don't want. And they will help you figure out what the best foods are based on your genetics to decrease inflammation, which will help your joints, including your knees, and hopefully slow down, if not at least mitigate the symptoms of the arthritis. But also, I mean, we've had plenty of patients. I'm not guaranteeing this, and this isn't medical advice, but we've had plenty of patients who've they've decreased the inflammation in their body, which we know can lead to cardiovascular disease. It can lead to diabetes, can lead to cancer. It can lead to all kinds of bad things. Obviously, inflammation in our joints, right? What we deal with all the time. But we've had people get off their blood pressure, their cholesterol, their diabetes, and their heart medications, all because they changed their diet to an anti-inflammatory diet. They lost fat, which fat causes inflammation, and they lost weight, or even if they didn't need to lose weight, they put on lean muscle, which burns more fat and also cushions your joints and also makes it less likely to have this overall inflammation in your body and joints. So it's pretty amazing that we've seen people literally, their primary care takes them off their medications, and now they're saving $500 a month on copays that they were paying for all those expensive meds. So it's pretty amazing.